Hello everybody on YouTube. It's been a few weeks since the last time I made a video, and this past week we've had some new stuff happen with my wrist. TFCC repair on the right wrist. As you can see, I'm already graduated down to a smaller brace. But before we get into that real quick, today is February 28th, 2022. Exactly 8 weeks post-op from my January 3rd TFCC repair on the right wrist. And I had my second post-op this past Thursday, the 24th, which was supposed to be on the 14th, but due to a snafu with scheduling, it wound up being on the 24th. And my first physical therapy appointment right on the 25th, the next day. So, figured I'd shoot a quick video just talking about how all that went. It had been, I think, 5 weeks since my previous post-op, if I'm not mistaken, and so there had been a lot of healing done during that time. I was in this brace, and I was showering with the big rubber sleeve that I'd put over my arm, which was kind of a pain in the neck, but it was necessary. I had to keep my arm dry. When I went in to see the doctor, I saw the surgeon, not just the PA, but the surgeon on the 24th, so that was a good thing. There was not a whole lot to update. I mean, I had a lot of questions early on, but he kind of cleared things up with a phone call, as I explained maybe a couple videos back. Most of all, I was mostly anxious about knowing whether or not the repair in the TFCC tear was strong enough where it wouldn't just pop apart if I did something wrong or if I bumped my hand too hard. And he said that at this point, at this stage, the only way that I could really undo the surgery or tear the scar tissue that we're trying to build here is if I lifted something real heavy, or I fell and braced myself on the way down, or if I went and just started punching things like crazy. And he told me that if it tore apart, I would know. So, you know, there's been a couple of times when I felt twinges of pain, you know, knocking my hand against the wall or something, and I was obviously very, anxious about that. So just to have that clarification and moving forward to know that I'm sort of past the point where my wrist is really fragile was very comforting for me. So he told me to continue on with this brace until the next day when I had my physical therapy in my hometown, and to wean off of this brace with the guidance of the physical therapist. Now, these were actually the same physical therapists I had worked with before, who had discharged me and said that, look, we can't help you anymore, you've reached terminal improvement without surgery, so you gotta go get a surgery. So now I'm working with the same people again, and they're helping me rehab. They're actually professionally, what they do is they help people rehab from surgeries. And when I had been working with them previously, they had pretty much been trying to figure out a way to avoid surgery, but it became pretty obvious after maybe 3 months that this stuff ain't healing. I need to get cut on. So their discharge allowed me to get this surgery, and now it's like I'm full circle, and they're working with me to get me back to normal. So immediately when I went into physical therapy, they had me take off this brace, and they said, don't throw it away. It smells like garbage, so it's tempting to throw it in the garbage, but they said, don't throw it away yet, in case you need it for something or you want to use it sometime if you don't feel safe about your arm or something. But it's time to sort of wean out of it. And I had this other little brace that they had given me when I worked with them before, and I said, hey, is this like a middle ground, something I could kind of graduate down to while I'm weaning? And they said, that's perfect, do that. So they gave me this little brace to wear when I'm walking around the house, or if I feel like I might bump my wrist into something. It's just nice. I feel comfortable and safe with it. But they said to really get my hand and wrist out of the brace, few times a day and do some exercises. And so they gave me a good moisturizing job there, and they told me to moisturize my incision sites. I got like 4 of them on the top of my wrist here, and I got the main one right there. I wonder if my camera will focus. Maybe, maybe not. Who knows? So that's sort of what I've been doing. They gave me this whole up here camera, whole diagram manner of different exercises for me to do 3 times a day, which I find myself just kind of doing while I'm watching a movie or something, or videos, or listening to music. I'll just be kind of, you know, flipping my arm, my wrists, because basically right now this is one of the exercises. I turn my hands over because I'm trying to regain motion and rotation in my wrist, because after being in one position for so long, it's super stiff and it hurts like a bitch to get it out of this, you know, this neutral position. So turning it over, this is as far as I can get. For reference, we're still at this kind of obtuse angle. I used to be more like this. Now I'm like this. We're 3 days into these exercises. I think I'm doing okay. I'm supposed to be kind of wiggling my wrist up and down a little bit. I used to have no upward motion with my wrist at all. Now I got a little bit more. So it's coming along. And, you know, I'm wearing this brace on and off throughout the day. And this is sort of the beginning of the next major chapter in this recovery, which is just physical therapy and regaining motion. And I'm going to start re-strengthening my wrist in a couple of weeks. Not a couple of weeks, 4 weeks. My surgeon said no strengthening until you're 12 weeks post-op. We're at 8 weeks now, so we got 4 more weeks till I'm doing any kind of strengthening. I'm not picking anything up with this guy at all if I can help it. I was given the okay to lift really, really, really light things. Like if I want to eat popcorn, I can pick up the popcorn with this hand. You know, that kind of thing. Super light duty, if anything at all. To pick up this piece of paper. Those are the restrictions, very strict restrictions. But the good news is I'm able to kind of shower with this arm and kind of do this, you know, with my, you know, wash my face or whatever. I'm slowly regaining motion in my wrist. That's really, really good to see. One thing I noticed is that this wrist looks huge compared to this one, or wide, I should say. I don't know, it's weird. It's like this forearm is sort of atrophied and it's like thin here. It's not proportional to the rest of my arm. I don't know. Strange. But the surgeon says there's still a lot of swelling in here, and it's just going to take time for that to go down. When I met at the post-op, he showed me some pictures from the surgery of inside my wrist, which were, oh, you know, just kind of scientific looking inside the body pictures. You don't even recognize what you're looking at unless he points out, hey, this is where I sutured your stuff up, you know. I still appreciated getting to see it, though. That's kind of neat. So, you know, moving forward, basically, I have another post-op. Let's see, March 24th. So that's basically in another month from now. I'm going to go out there, and that's probably when they're going to take a look at my wrist and give me the final okay to do some re-strengthening, which will probably involve 1 and 2 pound dumbbells going like this. Baby steps, right? And that is tragically where my battery died. But I'm back. So, to pick up where I left off, the next month is basically going to look like a lot of physical therapy leading up to my next post-op. Next post-op, as I mentioned, is March 24th. And up until then, the physical therapist decided they want to see me twice a week to do some exercises and other treatments at their facility here, kind of close to where I live, luckily. So that's good. After 2 weeks from now, I should be given the official okay to drive. I'm looking forward to getting out. I have some quarantine hair I'd like to get shopped when I'm able to get out. And 4 weeks from now is when strengthening exercises begin, and that'll also be when my physical therapy drops down to once a week through all of April. After that, I'm not really sure exactly where that's going. I'm not sure if I'll need another post-op. I might need one more sometime in May or something. They might have me go back out to Boston for one more time. My presumption is that sometime after April, the amount of PT appointments that I'll be doing will sort of drop to maybe every other week or something like that, but I don't know. Who knows? They've only booked me out as far as April, so in any case, it's a lot of appointments, and I'm just looking forward to getting this over with and making more progress. Super exciting to get out of that brace. Of course, now that I started filming again, I don't even know where it went. But I'm back. I'm in this, and on and off during the day. And even though it's a little bit painful because I'm stiff, I'm sort of free a little bit without too much concern of damaging the repair that's been done. Oh, one other major development was today, first day back on the contact lenses. So I didn't like I never liked glasses. I'm glad to be out of them. So thank goodness I'm back to my contacts. So that's sort of my update. Sorry for the hairy break in the middle there. February 28th. This will probably go up sometime in the next couple of days once I figure out how to edit it together, because I've never done that before. And this is the first time that's ever happened with the battery. So I'll have to make a note to charge it fully before I have another go at recording a video. So thanks a lot for watching. I'll probably have another video maybe when strengthening starts, or if there's any new developments between now and the next post-op, about a month away. So thanks again, and I'll talk to you soon.